Thanks, Julie. I'm thrilled to be here today and join healthcare leaders and experts to discuss how patient data and real world evidence plays a role in shaping pricing and reimbursement policies and improving patient access to medicines in the region. Patient data plays a crucial role in pricing and reimbursement decisions in healthcare, whether formally or informally embedded in reimbursement criteria. As a health economist by training, I tend to look at the importance of patient data through the lens of the law of economics. Patient data provides valuable insights into the effectiveness, cost, and outcomes of treatment, which ensures healthcare providers and policymakers use to determine appropriate pricing and reimbursement levels. We all know that we have infinite demands, yet there are limited resources. And this leads to choices that need to be made on how we decide to allocate healthcare resources. Which alternatives offer the best value for money? Can we afford the new treatment? Access to accurate and comprehensive patient data and real world evidence helps to ensure that healthcare services are fairly priced and appropriately reimbursed based on their value and impact on patient outcomes, and therefore plays a vital role in how we allocate what we know are limited resources. To determine the value of medicine, decision makers rely on different types of patient information to make informed decisions on pricing and reimbursement. Epidemiology provides essential data on the prevalence, incidence, and burden of disease within populations. This information helps policymakers, insurers, and pharmaceutical companies understand the public health impact of specific diseases and the potential benefits of new treatments. By analyzing epidemiological data, stakeholders within the healthcare ecosystem can assess the potential population size for a medicine, estimate the potential impact on patient outcomes, and determine appropriate pricing and reimbursement levels based on the medicine's value in improving public health. Additionally, epidemiological data can inform cost-effectiveness analysis and help prioritize healthcare resources to maximize the health benefit for the population. Demonstrating unmet medical need is also critical for justifying the value of a new medicine in pricing and reimbursement decisions. When there's a clear lack of effective existing therapies for a particular condition or patient population, a new treatment that addresses this unmet need is likely to be perceived as more valuable. This perception is because it can potentially improve patient outcomes, quality of life, and overall healthcare system efficiency. The value a new medicine brings patients and society can be demonstrated by highlighting the gap in available treatments and the resulting burden on patients and healthcare systems. This can include demonstrating the severity of the disease, the limitations of current treatments, and the potential benefits of the new therapy in addressing these shortcomings. Additionally, demonstrating unmet need can also inform policymakers and payers to which innovative therapies can address significant gaps in healthcare delivery. Now, the patient journey provides valuable insights into the real-world experience of individuals living with a particular condition or disease. Understanding these various stages of the patient journey, from symptom onset to diagnosis, treatment, and long-term management, helps stakeholders assess the value of new therapies in pricing and reimbursement decisions. By mapping out the patient journey, we can identify key points where new medicines and treatments can make the most significant impact. This includes improving diagnostic accuracy, reducing treatment delays, minimizing side effects, enhancing adherence, and ultimately improving patient outcomes and quality of life. This understanding of the patient experience helps justify the value proposition of a new drug or treatment, provides evidence of its ability to address these unmet needs, improve patient care pathways, and ultimately justifies its price and reimbursement. Additionally, insights from the patient journey can inform the development of value-based pricing models that align reimbursement with the actual outcomes achieved for patients through their treatment journey. Now, when we bring these various levels of patient data and real-world evidence together, we can quantify the different value new medicines bring, whether it's improvement in clinical outcomes, improvement in patient quality of life, productivity gains, or healthcare cost avoided. The use of real-world evidence is increasing in Asia and the Middle East. As healthcare systems continue to evolve and become more sophisticated, there is a growing recognition of the importance of real-world evidence in complementing traditional clinical trial data. Real-world evidence provides insights into how treatments perform in the real-world setting beyond the controlled environment of clinical trials. This information is valuable from a healthcare provider, payers, and regulatory bodies to make informed decisions about drug approvals, treatment guidelines, and reimbursement policies. In recent years, there's been a concerted effort in many Asian and Middle East countries to establish a framework for the collection, analysis, and utilization of real-world evidence. This includes initiatives to build robust healthcare databases, enhance data sharing mechanisms, and promote collaboration between stakeholders such as government agencies, healthcare providers, academia, and industry. While challenges remain, such as ensuring data quality, privacy protection, and standardization, the growing adoption of real-world evidence reflects a broader global trend towards evidence-based healthcare decision-making. As healthcare systems continue to advance, real-world evidence is expected to play an increasingly prominent role in shaping policies and practices related to drug development, pricing, and reimbursement in the region. Next, I'll hand over to Liu Chang, who'll be sharing a framework to guide real-world data collection. Over to you, Chang.